Coronal polishing. Armamentarium assembled. This includes your handpiece, Profi angle, Profi paste, air water tip, mirror, and floss. Patient placed in supine position. Operator positioned correctly in relation to patient. Use any clock position that allows the clinician to maintain an ergonomically correct position. Patient's head positioned correctly. Correct angle of light and at arm's length. Do not adjust the light with instruments in hand. Rationale for polishing provided to the patient. Procedure explained. Remove plaque, remove stain. Informed consent for polishing is obtained via the treatment plan. Mouth mirror utilized as needed. Evacuation used effectively. Select appropriate abrasive agent. This will be discussed in class. Utilize modified pen graft with your handpiece and rest in V-shaped area of hand. Fill the cup and distribute polishing agent to approximately 3 teeth. Establish fulcrum close to working area. Fill the cup again. Start the cup off of the tooth and apply it to tooth. You will use slow RPM and apply the revolving cup to the tooth surface for 1 to 2 seconds. Use light intermittent pressure, slightly flaring the edges of the rubber cup. Use a vertical stroke, a wiping motion, from cervical third of tooth to incisal or occlusal edge, covering all areas of the tooth, including the mesial, direct, and distal. Polish interproximal spaces, adapting the cup into proximal surfaces, turning your handpiece. Then you will polish the interproximal spaces with dental floss prior to rinsing the patient. You will do this with a patient that has good gingival health. If the patient is a perio patient, you will rinse them first and then floss.
Okay, the correct flossing technique is you will pull a piece of floss out about your arm length. You will take one end and wrap it slightly around your middle finger of one hand, and then your extra, which will continue to be your clean floss, will go on your other middle finger. This allows you to use these 2 fingers to control the floss. So for the mandibular, I slide back behind the patient. You want to take your floss between the teeth, not popping through the contact. And how you do that is you will take your floss and seesaw it back and forth until you feel it go through that contact area, and then you see it around the tooth going down into the sulcus, down as far as it will go to the junctional epithelium, and you will scrape up the side of that tooth with the floss. Then you would reel this, unreel this, it gives you a clean piece of floss, seesaw through the contact area again, and see around the tooth on the opposite side, go down to the junctional epithelium and scrape up that side of the tooth. And then you would wind up the dirty floss, unwind, so you have a clean piece of floss, and you would continue throughout the mouth.
When you are finished flossing, you will irrigate the teeth and interdental areas thoroughly with water. You will discuss the use of a polishing brush with your faculty, even if you do not use the brush. The brushes are used for occlusal surfaces with stain or heavy plaque. You will thoroughly remove all stain and or plaque And you will verify this with faculty by completing a final disclosing. This step is only for clinic and will only be verbalized in preclinic. Maintain tissue integrity throughout. Be aware of patient's comfort and maintain asepsis throughout.